This week's video is a staff spotlight, very aptly this week focusing on the work of the Wellbeing Hub. I had the pleasure of spending some time with the boost boxes team. Some really fantastic work going on there, and wellbeing really so important to us, particularly at the moment. And I'm grateful for all the work that's going on in the Wellbeing Hub, and also grateful to you all for just keeping an eye on each other and keeping an eye out for those who might be struggling and might need support. It's really important, and thank you for all that you're doing in that regard. Thanks.
Hi, Caroline Nesbitt. I'm leading up the Boost project, and what a delightful job that is. So Boost is kind of what it says on the tin. Boost is about giving a boost to as many members of our UHS family as we can possibly reach. We started off with bars of chocolate. That was 10,000 bars of chocolate into the organisation as quickly and as widely as we could do. Then we moved on to Boost bags, which were individual bags, a bit like these ones, for all our colleagues who were caring for and treating our COVID positive patients. And that was really about all of them. So the doctors, the nurses, the technicians, the allied health professionals, really all our colleagues, and the admin staff, housekeeping staff, everyone who was really having to don and doff PPE day in, day out. After Boost bags, we're now on to Boost boxes. Just some nice treats, as you can see. And this is the organisation recognising that COVID positive, those aren't the only patients for whom we're caring, and everywhere in the organisation has had to step up, step forward, offer staff, fill in with fewer staff themselves in order to keep the COVID positive areas going. What we're putting in the boxes, most of it has been from the hospital charity, either funded by them, or many members of the public have sent food gifts. And so the Boost boxes are a really efficient way of getting those donations out to the people for whom they are intended. Of course, I'm not doing this by myself. It would take me years to do this. Many colleagues have stepped forward to say, I'll help. And people have been just fabulous about doing whatever's required. Really, the reach is as broad and as deep as we can get. We are, of course, remembering all the ward areas. They're relatively straightforward, but also all the other areas, such as our portering colleagues, the waste management team, the stores team, the people in IT who've stepped up, patient services centre. It's a really long list. We've got pages and pages of where these boxes need to go. We have delivered to 55 areas in the trust, and we are at 3,707 headcount. We are, of course, remembering Princess Anne, our colleagues there, and at the Royal Southampton. So we really are doing our absolute best to reach as many people as possible. I feel so proud to have been part of this, to be part of an organisation that recognises that the well-being of every single person who works here actually really matters to them. Matters enough for David French, our CEO, to take time in. I'm sure he has a very busy diary, but he came up here for about 45 minutes yesterday and packed some boxes and delivered them. He was so enthusiastic. He kind of gets what this is about. And that's what you need in an organisation that believes in the well-being of their individual members of staff. So the Boost project, that's not going to reduce the number of patients admitted who are COVID positive, and it's not going to give us more staff. But actually in that moment, just helping people feel remembered, maybe valued, and actually, who doesn't like a biscuit, really?